perform the parenteral administration of drugs using the administration of IV medication via IV push. So the purpose of this is to achieve the immediate or the maximum effects of a drug. So this procedure will undergo steps such as the assessment, planning, implementation, and evaluation. For the assessment, we will assess our patient. We will assess the appearance of the selected site. We will assess the specific drug action and the expected outcome of the medication ordered. We will assess our patient's knowledge and understanding on the ordered medication. We will assess our patient's vital signs, most especially when the medication ordered is potent. So, upon performing it, I've already checked my patient's vital signs for the baseline data, and all of the vital signs are within the normal ranges. So after that, we will also assess the drugs, the side effects, the normal dosage of the drugs, and then we will also assess the range of the or the peak of action of the drugs. And then we will also assess the patency of the IV line. So, ma'am, may I assess the patency of your IV line po? Titignan ko lang po, ma'am, if there are any swelling or if the IV line po is still patent. Okay po. So, after that, we will now proceed on the planning. For the planning, we need to assemble all of the equipments to be used. So, we will be needing our gloves, our alcohol, dry and wet cotton ball, vial for the ordered medication, our sterile water, our sterile 3 ml syringe, our sterile 5 to 10 ml syringe, alcohol swab, micropore tape, pen, and our watch with digital hand. So after that, we will now make sure to check the medication against the MAR of the patient. So we will check the MAR of the patient. So as per order, the patient will be having a paracetamol for IV push. So, we will check the label of the medicine. So, paracetamol, expiration date is on January 1, 2022. So, after that, we need to make sure to compute or to calculate the normal dosage of the drugs accurately. And then we need to make sure to read the label of the drugs when taken to the medication cart, before withdrawing and after withdrawing the medication. So, after the planning, we will now proceed on the implementation. For the implementation, first is we need to perform hand hygiene technique or any infection control technique. So, I've already done hand washing, so now we can just disinfect our hands, and then we can put on our sterile gloves or our clean gloves. So, after that, we can now prepare the medication. So, we will prepare the ordered medication by first reading the label. So, paracetamol, expiration date, January 1, 2022. There are no cracks on the bottle, there are no foreign body, and the clarity inside is in good condition. So, we will now withdraw the medication ordered. And then when the ordered medication is already prepared, we will now prepare our patient. So in here, we need to establish rapport to our patient. So, good day ma'am, I am Career May Emisidra po, and I will be your nurse for today. I will do the IV preparation for the IV push po. So to verify your identity ma'am, may I ask for your name? Also ma'am, may I look at your wristlet? So, it states here po that your name is Ayana Naku, bed number 1, sex female, date of birth po is June 9, 1998. Is that true po, ma'am? Okay po. So, ma'am, we are going to perform the IV administration po using the IV push po for the ordered medication. So, in here po, we aim po for you to achieve the immediate and the maximum effect of medication. So, in here po, we will just inject the medication on the IV part po. You may feel a little discomfort po when the medication is already running through your veins po. Tell us po when there are any discomfort that you feel po that you can't handle anymore po. Also po, ma'am, you can cooperate po by relaxing your hands po as we perform the procedure. Is that okay with you po? Also po, ma'am, we will administer the paracetamol po as per order po of your doctor. Is that okay with you po? Okay po. So, now we can start po by the IV lock. So, in here, for the IV lock, we need to make sure first to prepare the medication. We will prepare the syringe. We need to make sure that we have a syringe with 1 ml of sterile water. So, it is already prepared. So, now, we can start on the steps for the IV lock. So, in here, we will look for the injection port. And then, when we already locate the injection port, we will clean the areas of the injection port. Starting from the center, going outwards in a circular motion for 10 seconds. And then after that, when it is already cleaned, we can now administer our sterile water. So we will just insert the syringe at the center of the injection port. Slowly insert it. And then we will draw up the 1 ml of sterile water for flushing and to aspirate for blood. And then we will remove it. And then after removing it, we can now administer the ordered medication. So we will just also inject it at the center, and then we will draw it on the injection port slowly or for the recommended infusion rate. So we will just draw it. When the ordered medication is already administered, we will remove it again. And then, we will now put the 1 ml of saline again for the reflushing. So, we will draw it up again, slowly, and then we will remove it. So, you need to make sure that when you are doing it in a central venous line, you can do the push-stop technique. So, after that, after performing all of the steps, we can now proceed on the existing IV line. So, in here, we will find the injection port closest to the patient. So, after that, we will clean the injection port starting from the center going outwards for approximately 10 seconds. And then after that, we will now make sure to administer the ordered medication to the patient. So, before administering it, we first need to close the clamp. So, after closing the clamp, we can now start administering the medication to the injection port. Or, you can also pinch the tubing or close the clamp before administering the medication. So now, we will now administer the ordered medication to the patient. So, by the use of our syringe, if we are using the needle system, we will insert it at the center of the injection port. And then when we are using needle less materials, we will remove the syringe and insert it on the port. And then after that, we will just slowly administer the medication at the recommended infusion rate. And then when the medication is already administered, we will open the clamps. We will open the clamp, and then we will slowly remove our syringe, and then we will dispose it. And then after that, we will just make sure that the medication is already administered to the patient. And then after that, we need to dispose all of the equipments that are needed to be disposed. And then we need to remove our gloves. We need to perform hand hygiene and any infection control technique. And then we need to perform the documentation for the evaluation. We need to document all of the findings. We need to document all of the procedure performed. We need to document the name of the medication, the time, the route, the specific drug action, the expected outcome, and then the patient's reaction on the procedure. Also, we need to document if there are any untoward reaction of the patient, and we need to document the effect of the medication to the patient. So that ends the administration of IV medication via IV push.